Yeah, we're recording in one place, but I can edit that. And we are live.
Hey, hi, it's Matt.
It's Suzie.
Hey, at Suzie Health Solutions, the full-service enrollment center in Wenatchee.
Yay!
I love my sign, don't get me wrong.
Okay, so
Hi.
we are going to talk about public options, the Build Back Better Act.
That is so hard to say.
It goes with my theme, Democrats suck at naming.
You also have the theme that they suck at marketing, so it all kind of plays together.
Again?
Yes. Well, somebody pointed out that for Joe Biden, who has a natural stutter, to name something Build Back Better was very brave.
Oh, okay. How many times have we stuttered over the American Rescue Plan Act?
Yeah, that one was a little stumbly too.
ARPA. It's incredibly stumbly, but it put a whole lot of money into people's pockets.
Yes, it really did.
And it's kind of important to talk to because the Build Back Better Act kind of adds to that.
It does. It's the next step.
Well, it's not the next step, and that's a really bad thing to say. It is what it does is it locks in some of the American Rescue Plan Act stuff.
Okay.
For example, the expanded tax credits.
Right. It's what it does is it permanentizes, makes permanent some of the stuff the American Rescue Plan Act put into play.
Correct. At least the last decade. It also gets rid of the states that failed to expand Medicaid.
Gets rid of?
Yeah. Okay. There is a point where states said, we're going to opt out of this.
Right, because that was an option given to them.
And literally break the Affordable Care Act.
That was the attempt, yes.
And the people in those states were down to 13. Did never expand in Medicaid.
Right.
So what you have is a gap of between 100% and 138% of poverty level that healthcare was unaffordable for.
Yeah, and then they're the people who needed it the most.
Yeah, and it's a fairly large percentage, and the American Rescue Plan got rid of that.
Yes.
And, well, guess what? The Build Back Better Act
will cement that.
And that's really important to note because we're seeing marketing, and it's marketing.
Of course it is.
From 2017 with the tax scam that put out this weird kind of assault on healthcare saying, oh, all we want's, what is it, Medicare for all.
Right. It's a really odd choice to go. So who do you suppose?
Not really, because if you look at it, if you do the this isn't what you want, so we're going to sit there and assault it, and it's interesting because they're using I'm seeing very classic marketing techniques. The reason I know it's 2017 is because I can click on the link on Facebook, it goes back to a post. And then it's a repost of something that they saved from 2017. And with a lot of likes and a lot of shares. And because it's got a lot of likes and a lot of shares, that repost has got a lot of weight in the logarithms.
Yeah. Okay, so let me see if I understand. We're not exactly sure who's dragging this out, but they're bringing back the Medicare for All push to say that the Build Back Better Act isn't good enough.
Correct. Because there are things in the Build Back Better Act that are real terrifying. For instance, the American Dental Association is lobbying against having Medicare covered dental coverage. You didn't hear about that one?
I did, but I can't figure out. I guess it's because they figure Medicare doesn't pay enough to make the dentist happy.
On the nose.
Because dentists pretty much are one of the few providers where paying cash is perfectly normal.
Yeah, because it's a mechanical transaction, and it's one of the areas that we see a lot of gameplay.
Yeah, that's true.
We actually had an excellent conversation with one of the board members of the Washington Healthplanfinder this weekend.
Yes, very wonderful, very wonderfully current.
And Delta is a great company. It's branded itself well, almost to the point of being too well, because people, if you're outside of actual health insurance community, if you think Delta Dental is like, oh, that's a great plan. However, Delta has done this great way of parceling out different plans for different programs.
That's true. They have built plans based on the niche they're focusing on.
Correct. So if you go in, for instance, the exchange, you can get your cleanings and checkups at zero cost. You can get half price for a filling or half price for gum treatment. But if you need a crown
or a root canal, any of the big restorative care, the expensive ones,
it's not covered.
It's not covered for adults.
So that's a really important. But if you go over into their private plans, you start to see this robust function.
And depending on who you shop through for that private plan through, you'll see different options.
Correct. You'll see different options on Costco. You'll see different options on ARP. So you get these different plans. We had a wonderful instructional a couple weeks ago on their Delta Cares program, which is a small group plan designed for 10 employees or more, that basically turns Delta Dental into an HMO plan that also provides orthodontics.
Yeah, so it's great for small businesses who want to put together a dental package.
Correct. Now, next month is I've started blurting it's dental month because
is it actually?
No.
Okay.
Except in my mind, and it should be. And this is why you can get the old prices for Delta Dental
and the
in November that start in December. However, you can also look at the plans that start
in
January. And the new prices.
And they've got some new plans out there.
Correct. So that is one of those weird times that you can shop in that 1 month and see which is your biggest advantage.
Exactly. I've got a lot of people coming in several people coming in next week to do just that.
Yeah, because it's open enrollment, so it's a good time to evaluate what you're doing.
Exploring your options. November is a great time to explore your options. It really is.
So it's really important to pay attention to the experts. Now, let's get into a little bit of conversation on experts.
Okay.
We're one of 11 enrollment centers. We've literally been on the front lines for the Affordable Care Act since the beginning.
Yes.
So we do a lot with customer service.
Yes, that's one of our primary goals is customer service.
Correct. And we try to focus on, the customer, which is it's a very weird point of view.
Yeah, that's not necessarily the most common choice for insurance.
Well, it's not.
Well, it is.
Well, it's supposed to be.
Right.
However, you've got this corporate override that says, what's the bottom line? And then you've got on the other side, the nonprofit side or the agency side, which it focus on, can I make this a pilot program?
Yeah.
And that's what we're kind of starting to see with the public option in Washington State.
Okay.
A good example was, it was literally yesterday. The exchange sent out their weekly producer bulletin with the, oh, hey, we're going to have this meeting on the public option.
Yeah, they kind of forgot to tell us about it.
So we're, as all of us are gearing up, they gave us, hours notice.
Yeah.
Hours notice for something as big and as impactful as the public option. And then when I tried to log on with multiple ways, half hour dead, not being able to log on. So me being the kind of person I am,
Mr. Diggy Man. Ow.
Yes, I went back and backtracked thanks to a few of my friends and said, oh, what's this public option are they talking about? And how does it impact us? and that's a really good example because they're not talking with their customer service teams.
Mm-mm.
They're not seeing that, hey, how do we improve the system? What products would like to be seen? They're getting select focus groups from the industry,
Yes,
which says, oh, I want to make as much profits as possible, and the select few customers that can dial in.
Yeah.
So it's not a wide selection where you've got, like the broker community, we talk with, thousands of people.
Yes.
And that's very important to note because we're seeing this disconnect.
Yeah, and that's problematic.
Well, it's how the Republicans were able to sabotage the Affordable Care Act early. Is they put this big rift between navigators and brokers. Yeah. And because they knew that both teams would provide customer service. Mm-hmm. Now, it's important to note that navigators get paid through a channel.
Right. They get a salary paid from, a channel.
They're the in-person coordinator groups, I can think of, there's like 6 in the state. Mm-hmm. They're scattered about, and they control the navigators who are different locations. And those are paid, last I saw, they were dispersed funds by, how many policies they control. Mm-hmm. Now, on the other hand, brokers, which is us, we can get paid in 2 manners. A, charging a fee, mm-hmm. which as an enrollment center, we are forbidden to.
We never did in the first place.
That's why we became an enrollment center. The second way is by contracting, by affiliating with an insurance company. Mm-hmm. Now, last year when Cascade Care came in, mm-hmm. we saw a couple companies say, no, we're not gonna contract, or we're gonna keep the contracts in-house.
Right. Which although the brokers were allowed to and even encouraged to sell and provide these plans mm-hmm. through the exchange, which is fine. We're going to show everyone everything. Mm-hmm. We wouldn't get a commission for it.
Correct. And so what you do is what they're doing is they're providing that, they're taking away the incentive for the brokers to promote these plans mm-hmm. and do outreach.
Yes.
Which is because that's one of the big complaints that we've heard is, the brokers are not going to outreach to where they're not profitable, so they took away the profits. That's one of the big complaints about brokers. That's why we've got so few Hispanic brokers in Eastern Washington.
Really?
Correct. You can actually look up by language type. Yeah. On the Healthplanfinder.
I know there's not a lot of Spanish-speaking brokers, but there's a lot of Spanish-speaking CS, customer service reps.
Weird, isn't it? Mm. So that's one of those things that you look at. It's like, okay, well, how are these organizations being funded? Mm-hmm. We do not get funds as an enrollment center. No funds go into our pocket. Let's make that specifically clear.
Yeah, we do not. None of the funds go into our household account to go buy groceries. Mm-hmm. Does not happen.
Yeah, so we literally don't get paid for this. We don't get paid for like last Saturday's meeting.
Nope.
We are forbidden to hold political events.
Right.
However, as a broker, because we're profit seeking, we're allowed to go lobby.
Yes.
We just can't use any funds for it.
Right. And we always make sure that we don't.
Yeah, so that's the important thing. We actually got a separate account, and we run it really tight that way.
Yes, we're very careful about that.
So, and so I've been on kind of this weird hunt for public option for years.
Yes.
And so I do my best to learn it backwards and forwards, and what is this plan? About half the plans I shoot down mm-hmm. Because they don't focus on the consumer.
No.
They do a fee for service.
That can get awkward.
Yeah, the fee for service, I'm not a big fan, and I really would like to see the community clinics and the education path of healthcare professionals be better supported.
Yeah,
I've got that weird. Oh, and the last thing, of course, you got to negotiate the pharmaceuticals. Period.
Yeah, that hasn't been happening. That needs to happen.
Some of that is they've been arguing back and forth with the Build Back Better Act. It can happen. So right now we've got going on in our state 300% of poverty level for your child, for people who work in a licensed child care facility.
Correct. If you are making 300% above the federal poverty level or less, you can qualify for a zero-cost silver tier plan. That's a zero premium. Zero premium.
Because you will still get copays, but you will also get an out-of-pocket maximum.
Yes.
Which is tremendous. The lack of out-of-pocket maximum for veterans health care is why I gave that up so I could jump on and use the exchange. Because that out-of-pocket maximum literally it's save your house. Because if you get, our favorite way is to explain it is you get run over by a moose, spend the next 3 months in the hospital, the most you will see is that particular number. It's a game changer.
It saves the farm member. It has kept a lot of people from going bankrupt.
Now, they were going back and forth on the procedurals of this, and because they're going to drop it down to 250% of poverty level and expand it out to everyone.
Okay, that's good news.
So that was interesting. So they got to be eligibility, a resident of Washington State.
No problem.
That's no doubt.
This is a Washington State program.
This is Washington State. I actually told 5 years ago. It was when I started saying, "Oh, hey, if the feds can't do anything, you do it on the state level."
And that's what's happening.
And that's
in a lot of ways, we're kind of becoming a pilot program for the feds, aren't we?
Can be. We're looked at as an example. This public option is a good thing because what it did was it standardized a number of plans. What we're looking at now is the gameplay and the shenanigans that can lead to its failure.
Yes. And there is some behind the scenes shenanigans happening and some sabotage.
Because we mentioned the health insurance companies offering and changing incentives on different levels. Now, those two companies we mentioned earlier not offering last year, well, they offered sort of commissions this year.
One of them fully went for it.
I'm not going to say fully because they're at half of industry standard.
That's true. They are offering a lower commission rate than other companies.
Correct. They're offering it's below industry standard. It's why we've said, hey, we need to get on board. Like there's about 3 other states that have mandated if you're going to use our state exchange, you're going to offer a commission. And we've seen that all the way up in some of those cases, all the way up through Medicaid or our Apple Health program. And that gets rid of some of that gameplay. And it expands the reach because you get, well, guess what? Brokers can do outreach. Because they discovered at the first Wakely report that was actually posted on their thing that brokers have a high customer satisfaction rate, cheaper alternative, and we have to grab a lot of Medicaid individuals. Yeah. These are individuals we don't get paid for.
No, we don't. Here in Washington State, we don't get commissions for Medicaid enrollment. We don't ever turn anyone away for that.
Correct.
You don't have to. A broker doesn't have to enroll someone in Medicaid. There's no law. There's no rule. But we do because it's the right thing to do.
Yeah, because we look at this. It's being a good member of the community.
That's right, and that's huge for us.
We actually got into this program because of the Quincy Hospital and its failure to meet its bills.
Yeah, it was a big part of it, yeah.
Because I recognized early that if everyone had a health plan, that means the hospitals would get paid. That logic has actually played out with the states that did not expand their Medicaid, and they had a lot of the rural hospitals and clinics closed down.
Yes, that was scary.
They're still dealing with that. Okay, so eligibility, resident of Washington State, qualified health plan eligible.
Check.
has an income of below 250% of the federal poverty level.
Right.
Now, this is the important thing. Because all our clients that we've talked about that have cost sharing eligible.
Right. Because that's the cost sharing threshold.
That is the eligibility threshold.
So is the cost sharing going to continue?
Yeah.
Nice.
So yeah, you've got that. So enrolls in a premium assistance eligible plan, which means they can't say, no, I'm not going to take that. We've had to transition a bunch off last year because of the American Rescue Plan.
Right.
And E accepts all federal premium tax credits for the individual's households is eligible, including consenting to the exchange to verify individuals' federal information upon QHP renewal.
Now you say they have to take all of the exchange.
Yep.
Okay, so you can't tweak your.
Well, remember this is the basic. They're in the rule making session,
and this isn't going to take effect right away. This is 2023 is a projection.
2023. So it's literally well, actually they were from what I saw, they might roll some of it out early in the spring, but it will definitely be in effect by 2023.
Now, the American Rescue Plan Act is scheduled to run through 2022.
Correct.
So this is designed to, I don't want to say extend it, but like we said, lock some of those rules into place and create some new ones to continue to.
That is the Build Back Better Act.
Right. It is. The Build Back Better Act is going to dovetail with the American Rescue Plan Act and keep coverage more consistent. You're not going to, at the end of 2022, your numbers are not going to go whoop and skyrocket back up.
Well,
in theory.
That is if because they were looking at going into this to add tax credits at that up to 500% of poverty level, which has been done in a couple of their states.
Right.
Because they recognize that because of the gridlock at the federal level, not everyone was being served.
That's correct. People at 400% and over were definitely getting the short end of the stick.
Yeah, and so that's bless their hearts for the American Rescue Plan. They did that expansion. They got rid of that cliff. So at that 400% of poverty level, you won't pay more than 8.5% of your income.
Right, and we want at least that to stay in play.
So we saw this huge outsurge of private business owners and folks that were making really good money suddenly have access to those tax credits, which reduced their healthcare costs.
Yes. Huge. Thousands of. I had someone that was saving about over $1,000 a month because of that change.
Yes.
It was a big deal.
So it's a big deal, and that's why we've been advocating for this Build Back Better Act. And anyone who's concerned about healthcare or concerned about healthcare pricing want to see that locked in.
Yes.
Because let's go off on that a little bit. The Medicare component is another factor.
It is.
And not enough people are talking about. They're talking about lowering the age of Medicare eligibility from 65 to 60.
Right. And that's really interesting because of the age rating with individual plans. When you hit 60, your prices sometimes can get into the full price for an individual healthcare plan is a lot higher when you're 60 than when you are 20.
If you're paying full bore, yes.
Right.
And you've got a few health conditions and those co-pays and everything that concern you. Yeah, Medicare is a godsend at that point. Now, there's been a couple of groups that have come out there and said, hey, we don't want no part of that. I want to say NAHU is one of them.
Probably. One of the concerns I have from my clients is, will the funding still be there if that's extended?
Okay, this is the thing. Because it goes through reconciliation, that means they've got to account for the funding.
Well, I'm talking long-term funding.
No.
Oh, okay.
Because of the reconciliation process,
it
has to be a zero gain program.
Okay.
So the minute they said, "Oh, we're going to do reconciliation," it's like, Awesome.
It's
That
gonna
means that they've got to have funding components for that.
Okay, so
And the funding components for that are, oh my gosh, taxing those people that are making over $400,000.
Oh, little things like that. Taxing the billionaires.
Yeah, the ones, it's the multiple yacht money
group. The people who have yachts within their yachts, little
helipads and stuff like that. Yeah.
Literally Russian stacking doll yacht setups. Seen that? Amazing.
So yeah, it's the minute someone starts to downplay, it's like no, this is actually a huge thing. I mentioned the dentists. They don't want to see the dental. I don't know how the hearing guys are acting, or VSP is acting about the vision component.
Yeah, that's going to be. We don't hear much from VSP just generally.
Well, because they hold, they got the crown.
Yeah.
When it comes to vision, there's been enough documentaries on it. They hold the process of the glasses, the lenses, the frames, the insurance. It's gotten to the point where they are definitely king of the heap.
Yeah.
And our local, there's a lot of local dentists, local vision providers, optometrists that don't take it anymore.
No, you basically have to pay cash if you want glasses, and of course that means you're into the $1,000 range for your eyesight.
Mm-hmm.
And I don't know about you, but that's out of a lot of people's budgets.
That is out of a lot of people's budgets. That's one of our things. Suzie and I, we've got horrible vision. So every couple of years we go in, and if we paid retail price, we're looking between $600 and $800 easy.
More than that.
Okay.
Oh, yeah. Mine would have been over $900 this last time.
Yeah. Well,
I like fancy frames.
Well, it's not just the fancy frames; it's the lenses.
Yeah. Well, we both are so nearsighted. We need the high index lenses, otherwise they're going to be Coke bottles.
Yep. So let's see here. Then they go through the conditional eligibility verification and the reporting. But the interesting thing was the tax credits, because they're still opt-out. Eligible enrollees who are awarded state program assistance pursuant to this section may contact the exchange call center to disenroll from the state premium assistant program. So they're doing this. You can opt out of it if you do it manually.
Okay.
Which means you pay retail price.
Yeah, you lose all your credits.
We've seen that before, but the opt out is becoming ridiculous.
Yeah.
But there was one thing in here: procedural requirements, invalid appeal. They put that in, but there's going to be a weird sort of double check program within the Healthplanfinder.
Mm-hmm.
But the weird thing was special enrollment period, newly ineligible for state premium assistant. To be granted the SEP under this section, individual must be a Washington State resident, meet all QHP requirements, have an income at or below 250% poverty level.
Oh, yeah, that's the base on that.
Within the last 60 days of making them eligible or ineligible for state premium. This means
they have to have had a plan in place already.
No.
It
gives them a SEP if they drop into income.
So if they drop, so if there's an income change.
If there's an income change.
If you go from full-time to part-time and lose enough income to drop below 250, now what happens if you go back up?
It's
You're
an
locked
SAP.
in.
No, it's an SAP. You can go back and forth. They're creating that window to flow in and out, and we've seen that problem happen with the jump, because there's no mention of carrying those copays and deductible stuff to the next plan.
Oh, that's true.
So you're jumping plans in the middle of the year.
That can get awkward.
So you can never. It becomes difficult to accrue. Yeah. I mean, what happens if you're at the top gear and you blow through out of pocket max?
That's true. What if you are the accumulators going to carry?
They don't.
Yeah.
There's no place for accumulators to carry.
Okay, so
Or there's no way to lock in accumulators. The other thing that was interesting is in here that you could only do it with a silver or gold double plan.
Okay, that actually kind of makes sense.
Kinda.
Well, we'll see how that plays out.
We'll see how that plays out.
These are also early drafts.
This is the state premium assistant policy draft I'm looking at is
it's less than a month old.
Yeah, it's the 4th.
Yeah.
So it is in process.
And this is a living document. This is something you can go look up by on your own if you want to do some digging.
And I strongly, if you're at that 250% of poverty level, yeah, we don't make a whole lot doing this. To write the healthcare authority and be concerned about customer service. Because we literally, as an enrollment center, well, actually, it was before we were an enrollment center. We had people come to us, referred to us by government agencies that are supposed to take care of people, because we were willing to do the difficult thing of sit down and work with people.
Yep, that's absolutely true. And that sounds like a good place to stop.
It sounds like a good place to start. So, important notes.
Yes.
If you need help, there is help out there.
Yes.
Medicare is rolling out the 15th.
That's right.
That is the time.
That is tomorrow.
Yeah, it's tomorrow. Work with someone that you're comfortable with and that is trained. If you're working with someone that's licensed, pick someone in your area. That way, if there's any commission to be had, it stays within your area.
That's exactly right.
It's a good way to build small business.
Work with trained people. Work with people like me, who's a licensed broker. Work with a Sheba volunteer. I know you're not in love with them.
I'm not in love with the Sheba volunteers because any commissions that are available go back to the insurance company. They do not stay in the community. No. The Sheba volunteers their offices are run with tax dollars. Okay,
so work with a broker.
Work with someone. Go to Sheba volunteer, pick their brain, then go to a broker
for your enrollment.
Go for the enrollment.
Well, here's the thing: if you work with a Sheba volunteer, they can show you the plans and they can kind of explain how they work. They cannot suggest one for you.
Correct.
And they cannot facilitate. You are still responsible for your enrollment.
Nope. November 1st. November 1st is the healthcare enrollment.
That's correct. For the Affordable Care Act stuff.
Do not hesitate to pick up the phone.
Yes.
Or go into an office and say, hey, how does this thing work?
Yes.
There are a lot of plans. If you're used to a work plan where they give you 3 or 4 options, we've been doing with 31 in Chelan County.
And I think it's going to be really similar to that this next year.
It is. I actually counted out 31.
Is it 31 again?
It's 31 again. They've modified some of the plans, some of the copays, some of the out-of-pocket maximums.
And that's not surprising. They do that every year.
They do that everywhere. I want to say Tacoma's got 61 plans.
That's what they had last year, so that's probably right in that zone.
Yeah, so it's a
Pierce and King County have to.
There's a tremendous amount. So yes, if we're doing someone in like Spokane, Pierce, King, that's the point where we're going to do the, hey, you're going to want more than a half hour, particularly if you've got complicated things.
Yeah.
Because the other thing with this public care option is you might not have the widest networks.
Yeah, we gotta watch networks on those. We gotta definitely make sure that who you're seeing is going to be taking that plan.
Yes, that is
the
huge.
Public care options to have a narrower network, and we're just going to have to be on top of that.
And they played hardcore games with it last year locally. Community health, we still don't know how they were able to do this because it went past the Office of the Insurance Commissioner. It went past the exchange because the exchange had to approve these plans. But what they did was they said, oh, hey, we will cover you in Confluence except for primary care coverage.
Right.
They literally punched a hole in a network and turned it over and expected consumers and people who weren't licensed to work with them to magically understand that, hey, primary care coverage is not covered in that.
Right, and that's something that we will discuss. We need to wind this up.
Yep.
We're running over time.
So, we are out for now. So, there are options out there. You got to be engaged in the conversation now.
Yes, do it now, and things will get rolling, and we'll have you set up for January 1st.
Yep. So, bye-bye for now.
Bye.